You can't build health system in 1 year. You just can't. You can't build the right infrastructure. You can't train doctors and nurses and even community workers and pharmacists and health managers, health planners, financial managers. All these people are absolutely essential to run any service. And to actually rely on a 1 day or even 1 week workshop to train a community worker, that is not enough. So what we need is long-term financial and technical support for these countries to build their health systems so that it can deal with normal, if you like, normal health needs, malaria, pneumonia, case vaccination, antenatal care, women delivering, all the kind of health care that anybody needs, and to also deal with potential outbreak. For that, you need long-term adequate financing for the countries. And that's what donors have not committed to yet. Well, the idea is that the research and development for medicine vaccines depends on the market. If there's commercial market and therefore profit, pharmaceutical companies research something and develop it. If there isn't, they don't. So there was a market for HIV, they developed the medicine. And because they want to maximize profit, they sold it at very high price in the north. Yet the patients were in the south and they couldn't afford that price. That's what I meant. For Ebola, it affects normally, the outbreaks have been with very small numbers in Africa. But even if it was a big number, these Africans are not able to pay for vaccines or medicines. So there's no incentive for companies to develop vaccine or medicine. In fact, all the vaccines that are in clinical trials now and the medicines have been researched by public money, either in universities or the government, particularly the US government, giving small biotechnology companies grants, basically giving them money to investigate a particular molecule or a particular vaccine. That's why we have 3 vaccine candidates now gone through clinical trials. They exist. They didn't come from nowhere. Companies didn't research them yesterday. They were researched already, but they were not developed because companies were not interested. Now that there is interest, commercial interest, the companies are going through clinical trials paid by public money. So they're not even paying for that. It's public money. So it's US, UK, and others are paying for that. The question is, once we have a vaccine, how are they going to price it? Given that so far all the funding is public funding. Pharma will pay for developing the vaccines, obviously, and then for production, manufacturing and production. That's fair enough. But how, would they price it to cover their cost and make little profit, or would they price it at high profit? We don't know. So basically, the system for research is wrong because it's not dictated by public health needs. It's dictated by commercial interest. Also, although the public purse, basically the government pays for a lot of the research for almost all medicines or vaccines are done by public money. If you think about it, people don't stand in a lab in a company and say, "Oh, I discovered a molecule." It's actually based on a lot of university research, which is funded by government, and it's in the public domain. Basically, the research is published, which says this disease works in that way and does this to the body, and therefore that's how you target it if you want to cure it, or that's how you target it if you want to prevent it. So a lot of that basic research is done by public money. What we need is more commitment from all governments of the world, not just the US or the UK, to fund medical research. And then you need transparency on the cost, because we don't know the real cost, and we need affordable prices. So funding, that it should include systematic public funding, transparency on cost, affordable prices.